Patrick Aliganyira is the program specialist at Save the Children. Good morning, Patrick.
Good morning.
How are you?
Brian?
You have released a report that is quite shocking, and we see more and more mothers, first of all, preferring to go to urban cities. Why? Why is that?
I think it's a general trend, and that's what we'd expect with civilization and urbanization coming up. We see most people living village kind of settings going to urban setting with the expectation that things are better down there in towns. The expectation services are available in towns. The expectation they'll be able to get services that are maybe better off in the village, like, for example, getting in touch with a health worker, accessing a health facility to deliver, or even having the best opportunities to be a mother. So we see that trend increasing, but also, of course, there are other obvious reasons of employment opportunities for the youth and the like, and then motherhood sets in at a later time.
Right. The same research also says that children that are living in cities are surviving at higher rates than those living in smaller areas?
Every year, Save the Children does an analysis of where is it best and worst to be a mother worldwide, and they rank countries. Uganda, we rank on 41, by the way, out of 179 countries ranked.
We are doing badly.
We're doing badly, with Norway has been ranking the best over several times now. And this year's focus, the key message was about the cities and survival of mothers and children in those cities. And they tried to compare different countries in the developed world and then developing world, Uganda where it belongs, and trying to see what are the chances that mothers and children have to survive in those different cities. And this year we took an advantage. Uganda, and Kampala in particular, was highlighted in that research to see how is Uganda faring, how is Kampala faring in terms of maternal and child survival, for that matter. The report gives us a very clear message that we have always assumed that mothers in cities actually have better chances to survive. But it again, such a kind of assumption kind of masks the reality that is underground of the poor in the urban settings are even worse off the poor in the villages at certain points.
Are you serious?
If you go to the slums in our areas, even from where we are seated now, you're going to realize that we are assuming someone in Bwais or somewhere in Kalere can be able to go to Mulago and access the services.
But is
that true? We also know there are very many hospitals, very many clinics, very many pharmacies in Kampala, but can the poor actually access those services? Not necessarily. So we see that we have been making that blanket assumption. It is not a reality, so this research gives us the opportunity to appreciate that actually we need to pay attention to the poor urban citizens, and we need to make sure they access the services, not just looking at the rich that we always see getting pronounced in terms of access to the health services.
According to your research, what are some of those things that you have found out that actually make it hard for mothers to be a mother in these countries?
Yes, if you look at the bottom 10 of the worst performing countries, this year we had countries mostly from West Africa, and some in the Horn of Africa.
Nigeria, Somalia,
Chad, and now Liberia. And you see there are some commonalities across those countries. One, civil unrest or wars going on in those different countries. There's a lot of inequity in terms of political involvement for women versus men. There is also other prevailing issues, like, say, we had Ebola in Liberia and Sierra Leone recently that led to massive breakdown in the health systems. And we've also had other issues, but most especially has been more of the civil unrest that have been in most countries. And when it comes to, say, the cities and the towns in those different countries, later on I'd like to tell you about East Africa specifically and how our cities are faring and how Uganda compares to the rest of the cities. We see that Somalia still has the worst places to be it in a city, be it in the village.
Somalia is the worst place on earth
to be
a mother.
Chances are high that you're not going to survive as a mother, neither will your child survive after birth. Whereas when you go and you come to East Africa, Uganda still ranks among the best in the region, and Kampala city is the best in the region for the mothers and children to survive.
How is that possible? That's very weird to believe. How is that possible that Kampala is doing very good?
Yes, in 2006, we were seeing that 3 out of 10 children born to poor women in the city were likely to die compared to those who are born to the wealthy ones. But now we are seeing at least in 5 years' time, they had reduced to 2. That means there's some kind of improvement. But the question is why? The research has showed us there has been kind of efforts that we also know that actually existing, regardless of the other questions you may ask whether it is true or not. We know that there is an effort to increase access to services through government health systems. We have seen reconstructions, we have seen critical messaging on health behaviors and like going on in the city.
And saving of mothers at childbirth.
Exactly, focusing on that to go and deliver in health facility, ensuring that the health facilities are available within the city here. And we have to really commend the work done by the city. You may question who is, in this case, the city it means. But we know there's a huge influx of refugees. There's a tremendous increase in population. We have seen a 4% increase in the past 5 years of the Kampala population. A huge increase. But at the same time, we have seen a huge reduction in child death, maternal deaths within the city. In 2006, 94 out of 1,000 children born to mothers in the city were dying before the age of 5 years.
That's in Kampala.
Yes, in 2011, 65 deaths of children out of 1,000 deliveries happening in the city. That's a huge increase, and there's no other city that matches our rate in Africa, and that is for us, we think, something we need to celebrate. But also it is a lesson to learn, first of all, to look at what caused this decline, what can we learn and what can we take forward. If you look at sanitation improvements in the city, we have seen those improvements going on. We are looking at also improvements in housing and reduction in overcrowding and all that, which is a very good driver of communicable disease that cause the deaths of children and also instantly affect women. We are seeing also increase in access to health services. We have seen, for example, we did, as part of the research, we went and checked out Chisenyi Health Center. It is the second busiest maternity unit now in the country after Mulago. So you can imagine how much it is serving, all the pressure it has. But at the same time, it is at least there's an effort to make sure that people within that Chisenyi area and the other catchment areas are able to access services from a government facility. It is an appreciation that most people in those areas don't have the financial backbone to be able to access services from private clinics, private hospitals and the like. So there's that, but also, like I talked about, the constant messaging of health behaviors, care seeking, take care of your mother, of your child, go and seek care from a skilled birth attendant, deliver in the hospital. That has been going on within the city, has made a big difference. So those are some of the lessons we are learning. We are seeing our neighbors, Kenya, in Nairobi, the gap between survival of a poor child and the survival of a child from a well-off family is really big in Kenya. Talk of our neighbors in Rwanda, the gap is actually increasing.
It is so visible.
It is so visible that the child born from a well-off family has more chances to survive compared to
Isn't that what happens across the whole world? If you're born in a well-to-do family, you will definitely survive, regardless of whether you're in Africa, whether in Latin America or America itself.
Exactly, but should we let it happen like that? That's maybe the best question that we should be asking ourselves. Maybe not, because there's something that can be done.
You are bigger stakeholders.
Indeed.
At that level. You are doing, you're lobbying for, basic maternal health. But I also want you to talk to mothers who are watching this show. At our level here, at the household level, what can we do to make sure we save mothers? Yes,
indeed, the opportunity lies in the hands of each and everybody. We all have a role to play in ensuring mothers survive. But when it comes to the actual mothers themselves, they have the responsibility to make sure they go and seek care from a skilled birth attendant. They have the responsibility to attend antenatal care. They have the responsibility to adapt the best practice. For example, we have the basic things we say. When you give birth, please breastfeed your baby. At least 6 months, exclusively on breast milk, until the baby is able to take on other foods that you can be able to supplement. But we also know some of our mothers actually have real issues in terms of upholding that practice, because they have other issues to take care of. Even maybe even themselves, they don't have the capacity to produce the adequate breast milk to keep this mother going. And those are the poor ones. So the question is, can we make sure that even the poor are targeted even those in the slums that don't have the capacity, the financial capacity to access services from good facilities, are targeted in terms of reach by services from the government, even other institutions, other players in the field out there, to be able to intentionally target these poor mothers in the slums, even in the villages, not to be left out. They need to be targeted intentionally. To be able to bridge the gap that is between the rich and the poor, we need to be intentional in terms of targeting the poor mothers.
Right.
Yeah.
Do you have on the top of your fingertips the first countries, the top 5 and the bottom 5? Maybe some people may relocate to those countries where it is safer for mothers.
If you want,
I'd probably not go to those countries where it is not safe.
But if definitely we see that countries that have highest chances of surviving, Norway, basically the Scandinavian region, Norway, Sweden, Denmark, those countries have had the best opportunities and have the best indices for maternal survival. And whereas when you come to the West, all are in Africa.
Yeah.
The bottom 10. We talked of DRC, we can talk of Nigeria, we talk of Somalia, we talk of now Sierra Leone and like other countries in the West, Chad, yeah, and all that. So it just shows you how disadvantaged we are, but it also shows you that other countries have been able to make a difference, have been able to make sure that the improved chances of survival for mothers and children in their countries. We can also be able to make it. We know we do not have the enough envelope, resource envelope to make it happen, but it doesn't mean that we cannot do something. It is just a matter of making sure we give those who actually need, and not to make sure we're providing services in an inverse proportion whereby those who have are getting even more, like the Bible says, but let's give those who actually don't have the ability to access.
All right. Well, I have some messages here at Mercy Joan C on Twitter saying the people who make them mothers have also made their life terrible for them. Many of them are suffering. And at Kayaman Kahindi saying, it hurts knowing that at the end of the day, our mothers don't get what they deserve. Well, to comment more about this, engineer Michael Amboga is also on those conversations. Please go to our Facebook page, Morning at NTV, or tweet us at Morning at NTV. Your last word, Patrick, before we let you go. Yeah,
sure. I think the key message here is we need to bridge the gap between the rich and the poor.
Yeah.
We need not to assume that those in urban settings have actually, we assume that they have access to the best services. We need to be intentional in targeting them, especially in those slums. They actually lack the access to these services. And I think we know what to do. We have done a lot. For example, we have learned what we have done in Kampala. We need just to continue upholding what we have been able to do well, continue shining as a city of an example in the region and maybe worldwide, to continue being made a reference case for others.
All right, Patrick Alganyira, Program Specialist at Save the Children. Thank you so much for joining us this morning.
Thank you, Brian.
Let's continue that conversation on Twitter and Facebook. When I come back, we'll be looking at the results of the Champions League and the latest from the Azam Premier League. Aisha Sports is here. Stay with us.